today, as part of both of those hats that I wear, as well as my research hat as a professor here at UW, I'm going to talk a little bit about wraparound and technology. This is a topic that is obviously huge for the field of behavioral health and health services in general, in that health information technology has long been proposed as a method of supporting high-quality health and behavioral health care. And what I'm going to do is tell you about the learning objectives in 1 second, but first a message from our sponsors. Just make sure everyone knows that this webinar is hosted by the Wraparound Evaluation and Research team here at the University of Washington. You can go to our website and see all sorts of resources on the topic of technology, fidelity assessment, and other elements of data support to wraparound implementation just by Googling UW-WERT. It's also brought to you by the National Wraparound Initiative and NWIC, and all of the partners, all of us are partners, all those entities are partners in the National Technical Assistance Network for Children's Behavioral Health, operated by and coordinated through the University of Maryland, which is where Tiara is sitting there today. Thanks to Tiara for setting us up from her office there in Baltimore. Okay, so getting back to the topic for today. We certainly know that health information technology is a critical piece of health and behavioral health care delivery. We here at the National Wraparound Initiative and National Wraparound Implementation Center have been embracing and trying to promote different kinds of information technology, web-based and otherwise, to promote high-quality implementation of wraparound for many years. You could arguably say that it started, well, way back in the 90s with my mentor John Burchard, who pioneered some of the first data systems to support wraparound even before the internet was really something that any health or behavioral health provider used to support their work. More recently, as many folks know, we innovated the wraparound fidelity assessment system tools such as the Wraparound Fidelity Index, Team Observation Measure, and so forth. And so the NWI and National Wraparound Implementation Center and UW-WERT have for over a decade now had online data entry and reporting systems for the wraparound tools of the Wraparound Fidelity Assessment System. A second example is that, as we will talk about a little bit later in this webinar, is we have received a number of federal grants and contracts to develop electronic health records specific to wraparound that align with the practice model for wraparound. And that's really what we're going to be talking about during the majority of this webinar today. Finally, I'll just say that we also have, are currently exploring opportunities to develop something that we just have to do it because the name is so cool, but trying to create a iOS support to wraparound implementation for practitioners as well as parents, youth, and family members, and of course that would be called the Wrap app. And so stay tuned for movement on that piece of health information technology specific to wraparound in future webinars and other kinds of resources that we put out there. Today, like I say, we're really going to zoom in on the first of those two examples. We're going to try and communicate, and a lot of this work really, the credit belongs to Spencer Hensley, who was an evaluation specialist here at UW-WERT, who did a study of electronic health records in wraparound, and we're going to be presenting a good amount of his recommendations as well as data from that study. And so the first bullet here is that we're going to try to help understand the process of preparing for, selecting and developing and implementing electronic health records that may align with typical goals and needs of wraparound provider organizations and wraparound-based systems of care. So we'll spend some time on the big picture of the process that many folks may be going through right now of selecting and implementing an EHR. Along the way, we will learn of those experiences from that study that Spencer conducted of other wraparound organizations and systems of care in selecting and installing EHRs, which can provide examples for the field as well as kind of a reality check about how difficult this is. Third, we will try to we're going to endeavor to provide you with actionable information and resources to aid your group, whatever it may be, in facilitating EHR selection installation. And finally, at the end of the webinar, we're going to go back to that first long-standing piece of interest that WERT and the National Wraparound Initiative have had in health information technology and IT in general, which is to talk a little bit about a new movement here at the National Wraparound Initiative and WERT in developing a new piece of web-based information technology to support evaluation of wraparound fidelity and outcomes, and we're really excited about this. So those are our 4 learning objectives for today. Moving forward, I said that we were going to try and make sure we provide you with actionable information. I believe already available on the website of the National Wraparound Initiative, which is nwI.pdx.edu. There is a multi-page resource developed largely by our new evaluation specialist here at UW, Lydia Andrus, called Building or Adopting an Electronic Health Record for Wraparound and Systems of Care, a resource guide. And this is intended to be a more in-depth accompaniment to today's webinar. So if you go to the NWI website, or I think you can, Tiara, tell us all if this is true. You can, I think, just click right on it in your Adobe Connect screen. Is that correct? I see here EHR tips and resources. Is that something folks can download directly? And she has typed yes. And she's probably saying, you should know that by now, Eric. But yes, so you will, you have access to this document right now on your screen. So let's start by getting people engaged. Let's do a couple little polls. First of all, I'm kind of curious who's on the webinar. So what best, I see we have 65 folks. What best represents your role in Wraparound? Let's see who's on the phone today, so to speak, on the line today. Click your, go ahead and let's launch it. Click your best response, and we will share with everyone who is on, and consider, you know, for ourselves, this will be great information for who is interested in this topic. We'll give you about 10 more seconds to pick the best option. We've listed quite a few here. And if we get a whole bunch of others, we'll know we need to do better with our lists in future polls. All right, so let's go ahead and discuss what we're seeing here. So we didn't have too many others, but of the looks like 25 people or so who logged into this one. If everyone could be prepared to respond to future polls, probably more important. But here we've got a good number of system-level leaders. A second high vote getter is wraparound organizational leaders and managers. So we've got folks at the system and program level who are in leadership positions, and we've got evaluation research specialists. Surprisingly, perhaps we only have one IT specialist. They're probably too busy multitasking on other tech things to log in. I bet there's more than that out there. But we've got a lot of system and program leaders. We've got one parent or youth advocate, and a good number of wraparound supervisors as well. So good distribution across those kind of supervisor and manager roles. Let's go back to, do we have, I think, another poll next, Tiara, or do we go back to the PowerPoint now? Can you remind me?
So we do
okay. All right. So we were just warming you up. So here's the important question. Tell us about your current status of your wraparound provider organization or wraparound initiative or system of care in terms of electronic health records. How would you describe the current status of your organization or wraparound initiative that may span multiple organizations, as is increasingly the case? Do you have an EHR, but it does not meet your needs? Do you have an EHR and it meets your needs well, or a couple of the options? You don't have an EHR, and really what I think is real interesting is folks who are saying that they don't have an EHR and are seeking a solution versus they have an EHR and they're hoping to replace it. You know, those are the ones that I think are going to be folks who are going to be in a position to best benefit from this. I would say that it's really surprising seeing the votes coming in here. We got a lot of folks, and maybe this represents a positive trend in the field, that are saying that they have an EHR and it meets their needs well enough. which is really good to know. That's often not what we see in data that we collect from the field, such as the study that Spencer did. So a couple more seconds to finish, or are we done, Tiara?
I think we are good. We're going to go ahead and end.
Okay. All right. So we've got about, it looks like, a third of folks saying that they are seeking a solution because they don't have an EHR or are looking to replace their current one. It's a sad option to select that you have an EHR and it doesn't meet your needs, but you're stuck with it. Hopefully we can move you folks through some information we provide to advocate with your leadership to seek other solutions, because that's not a good outcome at all. Relatively small numbers say they don't have an EHR, only 7 out of about 30 of us. So again, representing trends in the field that, unlike a few years ago when it was about 50-50, it looks like we're now seeing the majority of folks who are on these things saying that they have an EHR of some sort. But obviously a lot of work to be done for some of you all. So let's talk a little bit about the role of EHRs in Wraparound. If folks are not seeing this, please type in. Go ahead. Oh, I guess I'm advancing. Here we go. So we're going to start off here, like I was saying in the learning objectives, by giving an overview of the process of selecting and implementing a new EHR, because it's frankly something that you cannot just go straight to what are the options available for Wraparound. There are not many options available for Wraparound, and even if there was a perfect solution, there would still be a lot of work to do to assess whether or not those that do exist are going to align with your organization's needs, customizing it and implementing it. So we're going to talk about the overall process for selecting and implementing an EHR, give you some concrete recommendations, mostly from Spencer's work, and talk a little bit about how Wraparound initiatives and systems of care might, in particular, navigate this process. You will see all of these useful resources, which are really about the more generic topic of EHRs in behavioral health. A SAMHSA EHR bootcamp, great stuff on the healthit.gov website. Another resource called the Healthcare Information and Management Systems Society, and an IT toolkit for behavioral health. All of these things are live, so you can click on them. We'll leave it up here for a minute if you would like. But all of these are also on the resource that is available there on your Adobe Connect or on the NWI website. So hopefully that will also give you a lot more information if you're in this, if you're doing this work. So let's talk first by deciding to move to a new EHR. For those of you who are not satisfied with what you've got or don't have one, I think that we all know that there's a lot of claims about EHRs and their potential benefits to behavioral health, which I think our data is showing this. We are seeing perhaps more and more benefits to EHR as they improve and as internet connectivity improves as well. So why do we think that they're beneficial? They benefit the practitioners of behavioral health, our clinicians, our care coordinators. They have the capacity, and I see a lot of family organizations who do parent-peer support using versions of EHRs. They streamline and automate the work. They can help demonstrate impact for organizations. They certainly can help aggregate and report for supervision, for management, and they can provide improved access to folks' plans of care and other resources for the practitioners. But moving then to the clients, certainly we think that EHRs can actually increase privacy because of all of the safeguards that are typically now built into to EHRs. They may increase privacy over what has historically been a lot of faxing of documents and so forth that may not be terribly secure. They can provide better care. We're striving to develop resources for wraparound initiatives that can, like I was saying, align with the wraparound practice model and reinforce fidelity. Better care can also be provided by having online resources of practitioners and providers that might be relevant to the needs of a client, which can in turn improve access both to information as well as to those services. And finally, increased accountability. EHRs can build in methods for frequently checking in with clients, youth, families, and others about their satisfaction with care and the outcomes they're experiencing, which theoretically should be able to be used to help improve the care they receive as well as the care that's delivered by the organization. And finally, with respect to improving the care that's provided by an overall organization, it can also benefit our health system by providing that kind of information, by providing interoperability between records. We're moving more and more into a realm where that is actually not just a dream but a reality. And certainly when it comes to wraparound care coordination, the idea that we have electronic resources that allow different providers to talk to one another as well as to a youth and family improves the capacity to coordinate care, folks being on the same page, delivering services that are in service to, as the wraparound model says we should, centered around a youth and family's identified needs. So all sorts of benefits to behavioral health. Now, with respect to wraparound, EHRs may be especially important if we can figure this out, right? Again, wraparound is all about bringing the people who are critical to youth and family with complex needs all to the table. If we have a place that in between those literal gatherings around the table where people can review plans of care, remind themselves of the needs, see progress that's being made or not made, we can facilitate communication across those providers and across those systems. Certainly, if you have this kind of paper trail that's more detailed, more readily available, youth and families can also be more easily transitioned to new staff when turnover does occur. And that does occur fairly frequently in wraparound, as we know. Janet Walker did a study that shows that the turnover rate is about 30 to 40% any given year among care coordinators. So that EHRs can facilitate those difficult transitions for families. And finally, we know that if we have all of our documentation in one place, as we've learned in our studies of wraparound-specific EHRs, we have heard from those who have adopted them that having the documentation available to a supervisor or manager provides additional accountability and oversight for this difficult work. A supervisor who's doing supervision with a care coordinator can easily pull up any and all information that they need before or during that session to really zoom in on the families that might not be making the most progress and need to have the most attention paid. So it can facilitate that accountability at the individual team or provider level, as well as at an organizational level, so that managers can ask, where are our highest costs, where are our worst outcomes? Let's problem solve around that. Now the problem, of course, is that all of that good stuff falls on the backs of the staff, who, like care coordinators, who then have to actually not just do the difficult work of convening teams, engaging parents and youth, overseeing the implementation of services in the plan of care, but they have to then do all of this stuff on their laptops or on their desktops. And so we need EHRs to be effective and efficient if we're going to actually achieve this promise. And so one thing, a reality check, and maybe we're seeing progress here, because a lot of people said that they thought that their EHR meets their needs well enough. But in our study that we conducted, there was this perfect bell curve where really the majority of folks just said, moderately. Maybe that's what our poll question is suggesting, is people are saying well enough, right? But most folks are saying that at best, their site's EHR, they're moderately satisfied. And a good quarter of folks said that they were not at all satisfied or only a little bit satisfied. Not many folks have real high opinions of the systems that they use. Another way of looking at it is using a standardized measure. And this is something that you all can do when you are implementing a new EHR, is to ask, is the version that we have right now actually achieving the usability that we need these systems to achieve? So there's a tool called the System Usability Scale that is a standardized measure of technology and other kinds of usability, and has questions like, I find our EHR unnecessarily complex, or on the positive side, I feel confident using it. And our study found that when you ask what is the average score on a 0 to 100 scale from the SUS, which is just 10 items, really easy to do, the average score was 42.4, and this is well below the threshold that the developers of this tool have set for acceptable, and also it is below the threshold that they've set that suggests that a piece of technology is unacceptable. So 2 points to be made here is, again, in terms of usability, EHRs in systems of care and wraparound get low marks typically, and also you can use this as a tool. Something we might want to put up on our website along with these resources is the SUS, but I'm sure you could Google it. Use this 10-item tool with your staff if you're wondering how well they think of it. And if you get above a 68, you're doing great. If you get above a 50, you're still doing better than average for wraparound EHRs. Some other things that we collected in terms of motivations to move to a new EHR system, which people might find useful, is the typical motivations for doing so. And the two biggest motivations in the wraparound world, it turns out, are to standardize the information collected and to do analysis and reports. So interestingly, it's not about improving continuity of care or fidelity to the practice model. The biggest things are making sure they've got the information they need in a standardized and consistent way, like progress notes, perhaps plans of care, and then to have data easily available for analysis and reports. And I would say that that's probably the biggest things there are things like cost and length of stay. Hopefully outcomes are also important to folks. But you did see that, some folks said that a primary motivation was indeed improving continuity of care, which EHRs can do, I think, if they're effective. Lower on the list, funders, payers required it or to keep up with the times. But these are some of the reasons that people in the wraparound sphere are currently moving to a new EHR system. I got to use the little arrow here. So those are some context around deciding to move to a new EHR. The biggest point that we want to get at here is then how do you in fact select a new EHR or build one yourself if that's the direction you want to go. And those are both common approaches. You can either take one off the shelf, and as we'll talk about, you're definitely going to need a pretty intensive effort of adapting any EHR that comes off the shelf to use for our purposes in wraparound. Or you can build it yourself. But regardless, let's recognize that this is not just a piece of software. You're not just installing an app for your whole organization or wraparound initiative. This is something that is going to transform your business. And so you have got to make sure you are allocating enough time and effort and energy to this process. You can't shop for an EHR the way you would just shop for any other kind of software or information technology. So among the resources that I shared is the HIMSS website, and folks should know that this document, which is really useful, kind of walks folks through in a lot more detail than I can, a 5-step guide for EHR vendor selection. It's not customized to wraparound, but certainly is going to hit the stages that any behavioral health provider is going to need to go through. So first, starting with EHR planning, which we'll talk about, setting goals that can be achievable through EHR, and compare EHR vendor products. It also gives you nitty-gritty information about how to put a request for proposals out there, as well as then to select vendors and, the ever-fun part of the process, which is negotiating your prices and contracts and terms thereof. We're going to talk a little bit about the first 3 of these, planning for your EHR selection process, making sure you're setting goals for it that are clear, and comparing those products. So before you can evaluate vendors or select an EHR, you need to know several things. You need to know before you start doing any kind of RFP or scoping out there what you want to achieve. People often just skip this step. You need to know what the bare minimum is that the system has to accomplish and what your system would accomplish in an ideal world if you had a magic wand. What requirements do you have? How much can you spend? What your workflows are like? What would you like your workflows to be like in the future, which EHRs can facilitate? And finally, the degree to which any specific vendor is likely to be right for your organization. What kind of relationship do you want to have with a vendor? And are you going to need, extensive customization of something that they have? Are they going to build it for you? All of these things need to be thought through before you launch this process. All of this is for you to decide, not for an EHR vendor to tell you. And it's amazing how many folks think that this is something that you start by calling the EHR vendor and asking them to help you through this. If you do that, you're in trouble. You need to have these things in mind and have invested the time and effort among many people before you ever make that first call. So how do you do that? We really recommend that you make sure you have an EHR Selection Committee that is on top of these decisions. Include representation from multiple divisions and level of the organization, so you do have those managers and executive folks. You've got providers. You've got folks who are involved in billing, which increasingly EHRs are going to allow you to do even across many, many different service providers, as is typically the case with wraparound and care management entities. And of course, your IT folks. But don't just rely on your IT folks to do this. You need a team that spans all of these different roles. You can task one person with being in charge, like your EHR champion. That is a good idea. You need someone to manage the details. But again, do not just rely on your IT folks to make these decisions or any one of these kinds of roles. But at the same time, you of course need to make sure you include folks with some tech expertise, someone who can translate the clinical needs that your organization might have into the features that a vendor may ultimately start negotiating with you around. So the EHR Steering Committee that you're going to pull together, the purpose here is to do several things, is to demonstrate and support whole organization buy-in to this. So if you span those roles and those folks are actually informing the folks in each of their units, you're going to demonstrate that you're trying to get input from everybody before you just toss something at people without their knowing. This is one way to make sure that doesn't happen, is to start with this EHR Steering Committee and have it have diverse representation. Gets the required people at the table and helps guide the project, the management of the project. Certainly, again, it could be led by your CEO or senior executive, could be, but you also want to make sure you're including those finance, QI, IT, clinical, and operations folks. Now, can't say this enough. Be careful, allocate time and resources, and take your time. Here's some data that we found from our study, which is that from the point in which wraparound organizations decided it was time to explore an EHR to the time that it was rolled out, on average was well over a year, with the modal response being 2 years. And a good number of folks saying it took more than 2 years. So assume that this is going to take a couple of years, and make sure that you give it the requisite time and attention that that's going to require. I would argue that you probably can shift this time frame down to fewer months than 25 plus or 2 years by doing the things we just talked about, convening a team that is thoughtfully going through the decisions about what the EHR's purpose will be and so forth in advance. So what are those kinds of decisions that this group does that might make this a lot more effective and efficient? You got to start by asking these kinds of questions. What are your guiding principles as an organization? And it's kind of like developing a wraparound needs statement or a vision for the future for a family. In the long run, our system should help our providers do their jobs, not get in the way. That's a principle, right? That's a vision. That's not getting down to the nitty-gritty of the goals or the functions, but it's something that you should put as a banner across all the work of this committee and telegraph it to all the staff in the organization as you do this work so that they know what the guiding principles are for your organization doing this EHR selection and installation work. But then you do have to get to what are the goals. So examples, and these are not goals for the EHR. Start again with a vision for the future and your needs statements, just like in wraparound. But here you're going to talk about your goals for your organization. We overall are looking to expand services. We want to make sure we improve X number of outcomes for clients. We want to improve staff satisfaction. We want to reduce turnover. We want to demonstrate impact to stakeholders. Talk about what the goals are that EHRs can support, but not necessarily, you don't start with the functions. You start with the goals for the organization. Then, after you've done those first two things, just like in wraparound planning, you go to the question of the features, right? So you've got your vision, you've got your needs. Now you can start brainstorming things that might meet the needs. And only then do you start talking about features of the EHR. And as you do this, talk about the things that you know are absolutely essential and how they would map to these goals and principles, and things that you don't want. And make sure as you do this, you're talking to staff about the goals they have for the system, how they see the EHR potentially meeting the organizational goals, and what their workflows are that might require you to, that might influence what you build or what you solicit. So let's go to another poll. Tiara, thank you very much for including these helpful little icons to remind me that it's time for a poll. So see if everyone's awake out there. Tell us what you would say is the primary or function or feature you would seek from a new EHR. And, you know, this could be just for folks who are seeking a new one or don't have one and are looking for one. But I want to get anybody who wants to chime in, feel free. Would you say your primary function or feature is to support high-quality practice? Is it about that consistency of documentation? Is it about supporting communication? Is it about reporting? Is it about billing and costs? And, you know, it's real easy to just click all of the above, but you can, I think, select multiple items. So, you know, maybe the best thing to do would be to click the ones that you can click multiple of these rather than all of the above, unless you truly feel like every single one of these is the absolute highest priority. So let's give you, people are really chiming in on this one. This is great. We can use these data. I see on our participant list folks from Fidelity EHR, which is one of the systems out there that does support, that is explicitly about supporting wraparound practice. So you guys can use these data. Okay, so I'll give you 5 more seconds. Okay. So people are kind of endorsing most of these at pretty high rates, but the biggest one is about that consistency of documentation. Totally makes sense. But we also see a close second is supporting high-quality wraparound practice, which I do think that because wraparound is so much about sharing information and then communicating across partners, that EHRs have the capacity to do. Lower down the line is billing and costs, and the communication and reporting is kind of in the middle, with reporting, you know, being a high vote getter as it has been in other ones of our studies. So thank you very much. That is very, very helpful and useful. Okay, so in our study, what did people say were most important? If you take a look at the results of the study that Spencer did, you can see that every single respondent out of 70-something said that case and progress notes were absolutely essential. The vast majority said HIPAA compliance, reporting, document uploading, customizable forms and templates, having service plans available, and customizable user permissions, whereby certain folks can view different things, were all absolutely essential. We won't go into the details here, but you can see these as examples of stuff you might be considering for your own EHR purposes. Some of the less essential things, I found this very interesting, that the very lowest vote getter on essential was the client portal. This is just not something that we're, a place where we were ready to go, it seems, at this point, despite, for many years, people in the care coordination field for adults and children and families saying that isn't it going to be great when clients, families, youth, whomever can go look at their own stuff online, and it's not just for the providers. People really are not seeing that as absolutely essential, which I think is interesting. And neither is a mobile interface, which is also interesting. And I think that might speak to just behavioral health being a little bit behind the times compared to other fields. But it's something we got to keep in mind as we pursue this idea or explore this idea of a wrap app. All right, step 3 for EHR. Now you want to compare your EHR vendor products, having done all of that grunt work, all that background work. There are many ways to find vendors. I have never had to do this personally, but I'm sure many of you have. You can ask other similar organizations who their vendor is. You can look at resources like a certified health IT product list. You can put out an RFP, and that resource I was telling you before even gets into what those RFPs could look like. And you can always do the thing that terrifies me, but I think could be useful and helpful, which is going to some of these big conferences like the National Council for Behavioral Health and talk to vendors. These are all options for finding vendors. Our interviewees had tips about evaluating vendors, and these were really good pieces of input. Ask about the costs of customizations or upgrades up front. Get very detailed information, because this is going to be a big part of your life going forward with a new EHR. It's going to be a constant stream of customizations and upgrades. How does the vendor handle that? What are the features that are part of the base package? Which ones are going to require extra costs? What is their approach to charging you for customization? You need to know all of that stuff up front, because you don't want any surprises. Ask about training support. Another thing you don't want surprises. Is this going to cost extra, or is this part of the package? What will it consist of? Will there be a help desk, etc.? Definitely get references from current users. Try to see the system not from a demo from the vendor, but in the wild if possible. And ask the current users very direct questions about what the pain points have been in developing the system and implementing it. Look into the vendor's financial health. This is a very interesting point that a lot of folks have said. For public companies, it's readily available. It would be a big disaster to find that your company that is supporting your EHR is going out of business. So you might as well, you got to go there. Ask them about how the data can be gotten out of the system, potentially into a different one, in a worst case scenario, like a company going bankrupt. You can't assume that all these companies are financially viable. Now, I want to spend just a few minutes showing an example from Fidelity EHR, which is a specific vendor, and not to endorse or support it specifically over others, but I do have to say that when it comes to companies that have attempted to do a wraparound congruent EHR, Fidelity EHRs is really the only one that I know of, and if folks have others, please put them in the chat box or email me. But just to give you some examples of ways in which an EHR might kind of support wraparound specifically, you can have functions, as this system does, that actually allows for dynamic entry and review, printing and so forth of things like needs, outcomes, and strategies, all kind of flowing in wraparound fashion from a needs statement. So you can see, can you find or create an EHR that does things like this, where if you're trying to support wraparound Fidelity, which was the second highest vote getter in our poll, one of the biggest things you're going to have to be able to do is have the information organized by needs. If you're using an EHR that uses different terminology or doesn't kind of understand that kind of concept, it is not going to be something that supports high quality practice. So how can you create or find an EHR that reinforces practice? This is one example. So you can see the needs statement, the strategy, tasks, and ideally you're also, as this system does, going to be able to select services and pay for them that are going to align. Obviously there are some other EHRs that have been developed for really high-profile wraparound organizations and initiatives, like Wraparound Milwaukee created one. I believe Choices has created one as well. But so you can see examples of those on the NWI website as well. But they were developed for those organizations, not for use by the field or for the field to take advantage of and customize for their own purposes. So other examples, you know, can the system handle team-based care coordination? So for example, maintaining your list of team meetings and who was invited, who attended, what the notes were from those meetings, the team members that, that were there, and so forth, the tasks that were assigned. Having this kind of a paper trail, so to speak, available electronically is going to be critical if it's going to support wraparound implementation. Obviously, in addition to the system being able to organize the information by starting with needs and going through the process of strategies, tasks, services, we also want to make sure that it is capable of providing information on progress that the family is achieving. This is going to be one of the biggest contributors to any variance in outcomes for any kind of health or behavioral health, is knowing what the team is working towards and tracking whether it is achieved. And so a system has got to be able to do that in true wraparound fashion. So, you know, here's just, again, an example from Fidelity